Hi, my name is Diana Klatt, and I am the Senior Product Manager at Nivi. Nivi is a chatbot that uses a health tech chatbot. My talk today is going to be about the agency of self-care and how centering users in health tech benefits everyone. So a lot of times we hear the term self-care and we think about, things like taking a bubble bath or having a glass of wine or things like working out and exercising and, getting enough sleep. And while don't get me wrong, that's totally still some form of self-care. That's not what self-care actually means. What self-care actually means is the ability of individuals, families, communities to promote health, prevent disease, maintain health, and to cope with illness and disability with or without the support of a healthcare provider. This is the definition of self-care. It's frequently talked about in other senses, and those other things like taking care of yourself and just making sure to keep sane, especially during this time when we're all living through a pandemic still, is important, but that's not the focus of today's talk, and that's not what I mean by the agency of self-care. So in terms of health tech, what I mean is that when we talk about self-care, we want to be proactive about our own health. So it's being self-active about your healthcare, hence self-care, right? So in this case, self-care means that we are working to empower users to initiate their own care and about the relationship between a consumer and a health system. And this, doing it through health tech, allows us to understand how to best engage with the system and how to be privy to how the system works. So what are things that we can do to address self-care and getting these people to be more empowered to be in control of their own healthcare? Something like a chatbot to this is Ask Nivi. Ask Nivi is a confidential AI-powered chat service that uses questions as an entry point to building sexual and reproductive health knowledge and empowering people to take action. This is the same thing you could use in a lot of other health services. We just happen to work with sexual and reproductive health. So let me show you how we have designed this chatbot to accomplish, centering users at the basis of our health exploration and getting people to get to better health outcomes. So first of all, before we even get to the health outcomes and trying to promote better outcomes, why do we even need something like this? So information scarcity in healthcare markets, it causes a lot of people to not actually go to physicians or seek out different types of healthcare. And there is a major lack of quality and trusted information out there. Sometimes people are skeptical of what their providers are saying. Sometimes we don't have all of the data that we need or information that we need, or we just, see a lot of poor engagement between a patient and a healthcare provider. And even, around the world, there aren't that many physicians to people. So there's literally just not enough resources. So something that we can do to help make it so that users know what they're doing is by having something like a chatbot. Because, if you ask Google a question, it's going to spit out a million different answers and it might not be the right answer. And then someone goes off and it contributes to the misinformation issue that is running so rampant currently. So what we do is we enable self-care by using behavioral science, insights, and smart engagement. So Ask Nivi is a chatbot, but beyond just engaging with the user, we also look at the information that users provide and consumers provide to us. So that way we can turn around and give them back that kind of information. So what I mean by that is that a user comes in and goes through a user journey and then discusses what types of health outcomes they're looking for, or they go through something to understand what steps of a health journey they should be at and trying to achieve their health goals. In terms of what we work with sexual and reproductive health, it's mostly things like family planning, understanding pregnancy, sexual health, reproductive health, and these things. And the insights allows us to adjust the way that we engage with our users and adapt, so that way we can talk to them at their level and then also get them to make better informed decisions. Not only that, we use a smart engagement to understand where they're at, who they are, and to give them resources that are curated to them. So that means that we talking to a user and discussing what their needs are and seeing what they want to do. we're able to give them methods that they actually would want to do. And also the resources and services where those things are located so they can actually go and get them for themselves. So they're not just given some kind of information, don't have any way to action on those items. Currently, as a chatbot, we've been able to service 2.4 million users across 4 different countries: India, Kenya, South Africa, and Nigeria. We currently have 8 different partner organizations we work with. And over 30% of our active users are asking questions and engaging in conversations. And to date, we've had 617,000 questions asked. So if you think about that, that's 617,000 questions that people don't know the answers to about their own health, and they don't know where else to get that, right? And maybe they're not comfortable talking to their providers. Maybe they don't want to find out from their family or their friends. Maybe they just don't have a resource, or they don't know where to ask that question. So having some kind of information or some kind of service in a health tech allows you to actually address these issues and discuss at a level, at a convenience that a customer would want. And I bring up that we have 8 different partner organizations. That's currently how many active partners we have. And that's 8 different organizations. That's a combination of provider groups, ministries of health, and different types of outreach organizations that partner together to get resources out to different consumers and different users out into wherever they are. They could be in rural India, they could be in a metropolitan area of South Africa, and it's making sure that we can get to all of these different users and get them to take up action and get to actually using some kind of product. And the reason this is helpful when we see how many people we can impact is that, not only prevent us from, or us to people are, but it's help in those different locations. So obviously this is helping the user because it gets them to an end action. It helps a partner because they know where they can allocate different resources, where they need more resources, where they need less. Maybe, be a partner organization. It also helps us figure out where different types of users and suppliers also need to send different things. So it's not just resourcing in terms of human resources for different types of health workers, but also literally products. So this helps us figure out where to pinpoint those things. So it does help in terms of, the user gets serviced and they get the best care that they can get, which is a big deal since healthcare system can be so scary. And then partners are able to use information and be more specific with the way that they're looking at different things. And then suppliers can understand where they're even supposed to send stuff, right? So currently, that's not usually what will happen. What usually happens is, a lot of people come into these different things, or the trends that we've seen a lot happening in health tech is that things are typically promoting one thing, right? So different companies can have chatbots as well that might be doing something similar, but they always push to their own providers. By having a partner organization and network the way that we do, we have the ability to provide out to everyone, and we maintain high ethical standards to make sure that we're not limiting anyone to any specific thing. So this way, it's more of having a myriad of options, and people are able to get to different things and different resources, and it makes it so that we're able to work together collaboratively to improve health outcomes, and in our case, reduce maternal mortality. So for an example, we recently did publish a case study with Sergo Ventures in rural India, and which is typically an area that is known to not have very much access and is frequently thought to not be using a lot of different tech or have access to different types of phones and whatnot. So as a chatbot, that we have to rely on different things like, cell phones, smartphones, internet access, etc. But the exciting thing here is that we found that, the use of mobile devices are increasing as we go through the pandemic, obviously, and it's just going to continue to increase. And it's increasing in a way where people are finding that their mobile device is a source of vital information, and it's also a tool that they use for expression, and they also gain trust in different things, right? So we're able to be on a phone also, and that empowers users to access all of these different types of methods in their own pocket. So they're not trying to figure out ways to ask questions, or they're not trying to where to go, who to call. It eliminates a lot of the. It also works to provide more precise and accurate information compared to things like Google and YouTube, which is a major source for going to learn more things and disinformation. So how trustworthy, works in line with the way that healthcare providers work, because it's something that that can rely on to suggest to customer patients that go through the process. So it's not just talking to them about what stage of health journey they're in. It also talks them through their health journeys. And on top of that, it's trustworthy, it's private. Some of these places and markets that I discussed, things are a little bit, they're like quite private. And by being in a platform where you can do a chat platform, you're able to delete it easily, which also continues to build the trust that you can have in a user, where they would continue to come back and get information from that source, right? That's the our whatever our platform is, right? You use us as their primary source of information to the greater scheme of get them out into making health. And then I want to leave you with some impact of like why it's so important to make sure that it's something that like a user is able to. A lot of think about a user when we're developing something, but we don't think shift from solving to how do we fund our solution, right? So some of the quotes about just having something that is so centered on the user are these two quotes, that a tool for entertainment only. Platforms like this chatbot are providing so much information and making people aware. Yes, it is a learning tool also. Females can teach their learn. So, they're like, quote is talking like specifically about our app at the beginning, or the chatbot at the beginning, then discussing how the power of technology being used as an educational tool. And then our second quote I have here from a woman is that we received incomplete information from outside, but from the chatbot, you get complete information with full description, including what it is, how to use it, and what can be the possible misconceptions, etc. As I have told you that I have heard about many side effects of copper tea, which for anyone that might not know, that is a type of many side effects just in now after having information from asking, right? So this one shows how a lot of times from external sources, they're not getting complete information to know what to act on. By being given information, they're able to combat misconceptions, and they intend to take up a device, right? And that particular method requires going to a physician, going to a pharmacist, like doing all of these different things, right? So it employs and creates this ripple effect into many different aspects of your health journey, and makes it so that you're able to get to all of these different things. And yeah, so it basically helps to get to the end goal of a health journey. And through all of these things, we see that, health by essentially focusing on the user at the beginning, and it does impact the rest of the fields or the rest of the chain going down into it. So yeah, I guess there's no questions, but yeah, thank you. If you have questions or anything, then reach out to .io. Research available on vaccine hesitancy there that we've recently done as well.